This is our hospital.
We have designed a hospital that allows our patients to efficiently be seen and treated. Our goal was to create a layout which meets every patient's needs, no matter their injury, as well as to create space where everyone could be comfortable.
Problems we decided to highlight in our hospital were understaffing, overcrowding, long wait times, low supplies, and technology.
To help with understaffing, we decided to design a system where we give paid internships, and for students, we pay for their college and provide better benefits for them working. And to help with overcrowding, we designed the urgent care to help decrease waiting time for those patients with less urgent needs.
To combat long wait times, we designed an app to triage patients before they get to the hospital. This will group them effectively without having to wait for a triage nurse to see them. To help with overcrowding, we have decided to make connections with other hospitals to help with supplies and buying supplies in comparison to how many patients come in.
To help with technology, we've decided to find what technology will be most beneficial to the hospital and those working, and we're also not going to waste money on old technology that doesn't need to be updated. For our innovation, we've created an app that triages you before you get to the hospital. The app will ask you questions about what you're experiencing while on your way to the hospital if you are driving. So when you get here, you can check in, and an ID at registration can help place you in an area best suited for your status.
Our other innovation is in urgent care. This helps filter out emergencies that are less urgent, such as a sprained wrist.
This is our urgent care. It's connected to our hospital.
This is our budget of before the plans are implemented. And this is our budget of after the plans are implemented.
Staff costs are actually higher because we are paying for school. Although these costs are higher, we have more employees, and therefore helps with efficiency and getting patients in and out faster to combat overcrowding.
Triage nurses are not needed as much due to the app, which reduces wait time.
We also have technology repair costs due to the innovation. We have these costs because the app requires constant updates to work properly. This is our first patient.
Due to low blood pressure, the patient was brought in via ambulance because they passed out. Once brought in, they went to the trauma room due to too much blood loss and low blood pressure. They then went to the OR to fix their broken arm. After they were taken to a patient room for observation until they were released.
This is patient 2.
She drove to the hospital and went to the ER. She was then taken back into the ER and examined. She was transferred to the x-ray room to get x-rays of her wrist and ankle. After being x-rayed, she was taken back to the ER and given a cast for her ankle.
She was also given a brace for her wrist. After given the cast and the brace, she went home.